The gentleman yields back. Are there any other members who wish to be recognized? Dr. Adams, you're recognized for 5 minutes.
Thank you, Madam Chair. Move to strike the last word. I do support the Transparency in Billing Act, which will amend the Employee Retirement Income Security Act of 1974 to require taxpayers to pay only claims submitted by hospitals that have policies and procedures in place to ensure fair billing practices. In recent years, hospitals have brought out physician practices and turned them into hospital outpatient departments. But today, over half of all physicians are employed by either hospitals or large healthcare delivery services. According to Third Way, 46.9% of physicians were employed by hospitals in 2019, and since 2019, that number has increased steadily to reach 52.1% as of last year. When hospitals buy out these physicians' practices, they are able to charge a facility fee, which is an extra charge for providing the same service. This added cost contributes to driving up out-of-pocket costs for patients. Hospitals are contributing to a larger problem in billing prices, which has resulted in a rise in prices for outpatient services. Outpatient services are projected to grow faster than any other service over the next decade at a steady growth of 87%. Growth in Medicare spending on outpatient departments outweigh growth in other areas, including prescription drugs, hospitals, home health care, and skilled nursing facilities, and that is not sustainable. Patients, hardworking Americans, our families and friends can no longer afford to shoulder these skyrocketed costs, high premiums, and crippling medical debt. These additional fees for patients receiving care at hospital outpatient departments are more than receiving the same care elsewhere. Affordable and equitable health care is something every American deserves. They need the United States to ensure that there is oversight for these aggressive practices that will prevent them from paying prices that they shouldn't have to pay. So I do thank my colleagues for this bipartisan legislation. It will be a step in the right direction because it is driving down the cost of health care for our constituents. It will truly enforce transparency in billing. We have a sacred responsibility to ensure that every American has access to quality and affordable health care. So let's continue to work together to make that happen. I do urge my colleagues to support this bipartisan bill. And with that, Madam Chair, I yield back.